Good evening, students. Am I audible to you? And my screen is visible? Good evening, everyone. Please confirm, students. Am I audible? Students, confirm. Am I audible? Okay. So, let's start. Thank you, Karthik, for confirming. Okay. So, let's start with our class. So, today we're going to start with the alpha adrenergic drugs. Okay. The alpha adrenergic blockers. Basically, we'll study about the blockers today. Okay. That blocks the alpha adrenergic system or the receptor. Okay, we'll start first with the introduction of the alpha receptor. Now, the alpha receptor, they are the part of the adrenergic nervous system only. Okay, so in adrenergic nervous system, they are the part of the sympatholytic drugs, okay, that act against the sympathetic system. The alpha, I am talking about the blockers. So before starting the blockers, let's have the introduction about the alpha receptors. Okay, now these alpha receptors are the part of the adrenergic system. They respond to the norepinephrine and epinephrine. So these are the two neurotransmitters, the norepinephrine and epinephrine, that are present or that the sympathetic system have. Okay, now these two receptors, the alpha receptors, they are the G protein coupled receptor. So in last class we studied about the beta blockers. Okay, so the beta blockers were also the G protein coupled receptor, if you remember. So the alpha receptors also are the G protein coupled receptor. Okay, now moving forward, now these alpha receptors are divided into the two types, that is the alpha 1 and the alpha 2 receptors. Okay, now the alpha 1 receptor, if we talk about the location, okay, now first we will talk about the alpha 2. Now alpha 2 is located at the presynaptic neurons. Okay, the location of the alpha 2 receptor. Now talking about the alpha 1 receptor, it is located, now we will remember the location of this alpha 1 receptor with the help of a trick. Okay, now remember this trick, 𝑉𝑘 pen. Okay, just remember this, 𝑉𝑘 pen. So from V we can say it is present in vessels. Okay, now from K we can say it is present in kidney. From B, the bladder. Okay, now from U, the ureterus wall. Okay, now from G we can say it is also present in GIT. Then P, the pupil in eye. Then from E, it is used in, it is present as an ejaculation, okay, where the ejaculation is going on. Then from N we can say the nasal vessels. It is also present in the nose, the vessels in our nose, it is also present there. You are getting it right, the location of the alpha 1 receptor. Now let's talk about the MOA, the mechanism of action of this alpha 1 and alpha 2 receptor. So alpha 1 receptor is a GQ protein coupled receptor. Now as it is a GQ protein coupled receptor, that means it will activate the IP3 and the DAG pathway. They will work by activating the IP3 and the DAG pathway. Okay, now IP3, the inositol triphosphate pathway, and the DAG, that is diacylglycerol pathway. Okay, now as this pathway is activated, okay, it will result in the increase of calcium level in our cytoplasm inside the cell. Okay. Now due to this increase in this calcium level in our cell, now as we already know that calcium is responsible for increasing the constriction. Okay. So inside it will result in the constriction there. Okay. So in vessels it will cause vasoconstriction. Okay. Now in ureter it will cause ureterus contraction. Okay. So it will cause contraction there. Then talking about the alpha 2 receptor. So the mechanism of action for this alpha 2 receptor is, it is GI coupled receptor. Now as it is a GI coupled receptor, now there I means inhibitory. So it has an inhibitory action. So basically it will decrease the adenyl cyclase enzyme. Okay, so it will decrease this adenyl cyclase enzyme. It will result in the decrease in the CAMP. Now the CAMP is the secondary messenger. Now it will result in the decrease in the protein kinase A. Now this protein kinase A is reduced, so phosphorylation of the protein is reduced. Okay, so we will get an inhibitory action here. So what type of action? Like it will decrease the norepinephrine release. Okay, it will decrease the norepinephrine release. Now norepinephrine is the alpha receptor only. Okay, alpha receptor neurotransmitter. Okay, clear? Should I move forward? Now the alpha adrenergic blockers. Okay, till now we were studying about the alpha receptors. Now the alpha adrenergic blockers, the agents that will block those alpha receptors. Okay, now these drugs basically block the alpha adrenergic receptors. They are also called as sympatholytics. Okay, that act against the sympathetic system. So in last class I told you about the sympathetic and the parasympathetic. Okay, now the sympathetic, how it works and at what condition the sympathetic system activates and at what condition the parasympathetic system activates. So if someone remember, please answer. Okay, at what condition our sympathetic system will work? Okay, can you answer me? In last class I told you about that. Okay, anyone? If your answer will be wrong, then it is okay. Okay, you will get from that. Okay, you will learn from your mistake. So it doesn't matter if your answer is wrong, just tell me at what condition our sympathetic system works. Yes, you are right, at the fight and flight condition. Okay, so it basically act at fight and flight condition or at the stressful condition. So it inhibits the action of the norepinephrine and epinephrine. Now these are the two neurotransmitters of the sympathetic system. So these alpha blockers, they inhibit or prevent their action. Okay, now they inhibit the usual effects like vasoconstriction. As I told you that the alpha receptors, when they were activated, they were causing vasoconstriction. So these alpha blockers will act against it. So they will cause vasodilation, increase in BP. So they will cause the lowering of BP, these alpha adrenergic blockers. Now moving forward towards the classification of the alpha adrenergic blockers. Now alpha blockers are divided into two types, that is the non-selective blockers and the selective blockers. The non-selective blockers, they can work at alpha 1 and alpha 2, both the receptors. And talking about the selective, they will have a selective action, that is some will act selectively on the alpha 1 and some will act selectively on the alpha 2 receptor. Okay, now the non-selective blockers, the 𝛽-𝙂𝙾𝙼𝙾𝑖𝑛𝑠, 𝘎𝑒𝑟𝑔𝑜𝑡 alkaloid, imidazoles, okay. The miscellaneous also we have. Then the hydrogenated alcoholic alkaloids, all these are the non-selective blockers, and the selective blockers, they are of two types, that is alpha 1 and alpha 2. Okay, now moving forward, we will start with non-selective alpha blockers. Here one by one we will discuss about the drugs. Now for some drugs I have tricks for you to learn, okay. So that will help you to remember the structure, okay, to solve the question during your exam. You can make your own tricks too, but I have also tried. So if you like my trick, you can use that also. So starting with the 𝛽-𝙂𝙾𝙼𝙾. Now this is the first class of non-selective alpha blocker, okay. Now first drug is the phenoxybenzoamine, okay. Now phenoxybenzoamine, let's talk about the trick first. Now it has a phenoxy, so it has a phenoxy group in its structure. Here is the phenoxy group, okay. Second is the benzene. Now it has a benzene ring 2 in its structure. Then the amine, so it has a amine group also, okay. Now like it is a 𝛽-𝙂𝙾𝙾𝙾𝙾. So this is the alpha position, this is the beta position. So at beta position here we have a halogen attached. What type of halogen? Chlorine we have attached here. Now why the chlorine is mostly preferred as a halogen? As because of its activity, like it is a good leaving group, it is less active than the other halogens, okay, compared to other halogens. So mostly the chlorine we use as a halogen group here. So here also we have a chlorine as a halogen at the beta position, and then the alkyl chain, then amine. So this is the alkyl chain and this is the amine. So it is a 𝛽-𝙂𝙾𝙾𝙾𝙾. Now phenoxybenzoamine, moving to that, the IUPAC name, the N-benzyl. At N position we have a benzyl here. At N position we have a 2-chloroethyl, okay. Then 1-phenoxypropane 2-amine. So that is the IUPAC name. Now talking about the uses, now it is used in pheochromocytoma. Now anyone know that what does a pheochromocytoma mean? Okay, what happens in pheochromocytoma? Do anyone know that? Okay, I'll tell you. So the pheochromocytoma is a condition, basically it's a rare condition of tumor, okay. Now tumor at adrenal medulla, okay. In your adrenal medulla the tumor grows, and due to that there is the overproduction of catecholamines. Now what catecholamines? Like norepinephrine and epinephrine. So for this we use phenoxybenzoamine, okay. It is used in pheochromocytoma. Then talking about the side effects, now the orthostatic hypotension and the reflex tachycardia. Now what is this orthostatic hypotension? Now during orthostatic hypotension, now whenever the individual, whenever he is sitting and then he stands up, any individual, okay, that time if there is a drop in the BP, okay, the drop in the BP of that individual when he stands up or when he lays down, okay, that time if the BP drop of an individual, now that condition is known as orthostatic hypotension, okay. Now why it happens? Okay, now this happens as whenever we stand up, okay. Now due to the gravitational force the blood flows downwards, okay, due to the gravitational force, and due to this, now this condition is managed by our body by vasoconstriction, by the action called vasoconstriction, okay. Now what happens due to now whenever our body stands up or whenever we stand up, our body answers with a vasoconstriction. Now due to vasoconstriction, the flow of our blood increases towards the heart. So the BP gets managed due to the vasoconstriction. But as in this phenoxybenzaimine, whenever we are having that, the alpha-1 blockers are blocked. So there will be no vasoconstriction. It will cause the vasodilation. So due to that, we get a condition called the orthostatic hypotension. Okay. Now the reflex tachycardia can also be seen. Okay. Now moving forward towards the next drug, that is the ergot alkaloid. Okay. Now ergot alkaloid, first drug we have ergotamine. Now this ergotamine, it has a partial antagonist alpha adrenergic blocker effect. Okay, only the partial, and along with that alpha blocking effect, it has other effects too, which are more potent, like it acts as an agonist at serotonin receptor, it acts as a partial agonist and antagonist at the histamine receptor, it also acts as at a dopamine receptor too, along with the alpha blocking property. Okay, now due to that, this, as the serotonin receptor action is the most potent action that this ergotamine show. So this alpha adrenergic blocking property is somewhat lost somewhere. So it is not the main property or the potent property for this ergotamine. Okay, so it is not, basically we use it as alpha blocker clinically due to its suppressed action. Okay, so its action for the alpha blocker is not too great. That's why we don't use it as alpha blocker clinically, but we study it under the classification of alpha blocker because it acts or it binds to the alpha receptor too. Okay, and it has somewhat a small or a mild alpha blocking activity, and this alpha blocking activity, basically it not contributes to the uses, but it contributes to the side effect. Okay, now I have written the uses here. So these uses are for ergotamine, but these uses are not because of its alpha blocking property. Okay, now first is the migraine headache. Now the serotonin receptor, the agonistic action at serotonin receptor, this property is due to that. Okay, now the hypotension, then side effects talking about the nausea, vomiting and worsening of the Raynaud's disease. These are the side effects for the ergotamine. Clear? Now, so if you are clear, then let's move forward. Have you understood? You can please reply me, otherwise I'll tell you again. And I'll move forward then. Are you people clear? Tell me. Okay, I'll move forward then. Imidazoles. Okay, now first drug in imidazole is tolazolin. Now first we will talk about the trick here. Now from tola we can say toluene, and then zolin we can say imidazole. Okay, so it has a toluene ring that is attached with the imidazole ring. Okay, now this tolazolin, when we talk about the IUPAC name, the 2-benzyl. So at second position we have a benzyl group here. Okay, now at 4,5-dihydro. Okay, at fourth and fifth position the hydrogen groups are added. Okay, and we have a imidazole ring here. Okay, so 2-benzyl 4,5-dihydro 1H imidazole is the IUPAC name for tolazolin. Now this tolazolin has a persistent pulmonary hypertension of newborn. Now the use of that is in the pulmonary hypertension of newborn we can use it, and in the Raynaud's disease. Okay. Now what is this Raynaud's disease? Now during this Raynaud's disease there is a vasoconstriction, or the vessels constrict, where in our fingertips, and the toe, okay, the vessels there get constricted. Now this constriction can be due to the cold or stress. Okay, now at this situation tolazolin is helpful. So this tolazolin results in the vasodilation there, okay, and that will result in the curing of this Raynaud's disease. Now this Raynaud's disease can even cause the whitening or the bluishness in our fingers as due to the less oxygen reach there. This is basically due to the cold and stress. Now side effects: reflex tachycardia, hypotension, nausea, vomiting. Now reflex tachycardia. What is this? Now this tolazolin and all other non-selective alpha blockers, they act on both the alpha 1 and the alpha 2 receptors. Okay. Now they act on the alpha 1 receptor, there they cause vasoconstriction and all. Okay. Now when they act on alpha 2 receptor, now alpha 2 receptor are present on the presynaptic neurons. Okay. Now here the alpha 2 receptor are present. Now these alpha 2 receptors are inhibitory in nature. Okay. So they result in the inhibition of norepinephrine. Now as these alpha 2 blockers are blocked now, so this will not result in the stopping of norepinephrine release. So it will result in increase in norepinephrine in the cell. Now due to that increase in norepinephrine, now this norepinephrine will go to beta 1 receptors, and there it will show its action. Now what action? They will increase in heart rate and force of constriction. Now due to this it will cause reflex tachycardia. Okay, now this is the reason it is causing reflex tachycardia, due to the blocking of the alpha 2 receptors. Okay, clear? Then hypotension, it can decrease the BP due to vasodilation. Okay, so BP can be reduced. Then nausea, vomiting. Okay, clear? Now moving to the next imidazolin, that is the phentolamine. Now first we will talk about the trick. Now trick is that it has a phentol. So from phentol we can say a phenol group. So we have a phenol group here. Then tol, we have a toluene too. Okay, the benzene ring with CH3, that is called toluene, and the amine, so phentolamine. Okay, now as it comes under the class imidazole, so it also contains a imidazole ring in its structure. Now here is the imidazole ring. Okay, so at 1H position we have a imidazole ring, then we have a methyl group attached there, then we have a phenol group here. Okay, so that is the IUPAC name, talking about the IUPAC name. Then the uses in the diagnosis and treatment of pheochromocytoma. Okay, now pheochromocytoma, I have already told, there is the overproduction of the catecholamines like norepinephrine and epinephrine. Okay, now it is used in the diagnosis and treatment of that. Now treatment we have already discussed. Now how diagnosis? Now they basically check the baseline BP, okay, the baseline PP of the individual is checked, and after that the phentolamine is given through IV. So if there is a drop, a large range drop in the BP after the giving of this phentolamine, so that proves that the individual has pheochromocytoma. He or she is suffering from pheochromocytoma. Then the hypertensive crisis, it is also used there. Then talking about the side effects, the reflex tachycardia due to the blocking of the alpha-2 receptor, then hypotension due to vasodilation and blocking of alpha-1 receptor, then nausea, vomiting. Okay. Now moving towards the next drug. Now the miscellaneous drugs. Now why miscellaneous? As their structure is different from the other classes of drugs, so it is in the miscellaneous range or miscellaneous category. Now the chlorpromazine. Talking about the trick here, we have a chlor group, so we contain a chlorine group in its structure. Then the from pro we can say it contain a propyl chain, and along with the propyl chain it contain a ring, that is phenothiazine. Now what is a phenothiazine ring? The ring here is known as the phenothiazine. So chlorpromazine contain phenothiazine ring in its structure along with a chlorine group from chlor and along with the propane chain. Okay, the propyl chain here with the pro and the amine group too. Okay, so chlorpromazine. Now it is used in the management of the agitation and the psychosis. Now talking about the side effects, we have hypotension, dizziness and reflex tachycardia again. Okay. Now moving forward towards the next class of drug, that is the selective alpha-1 blocker. So they will selectively block the alpha-1 receptors. Now first drug here is prazosin. Okay. Now prazosin. Now here the trick, first we will go on with the trick. Now from pra we have piperazine. Okay. Then with now these all the alpha-1 blockers, these are the quinazoline derivatives. Okay, so as they are quinazoline derivatives, so they will contain quinazoline moiety in their structure. So as the prazosin is also a quinazoline moiety, so it contains a quinazoline ring in its structure. Then from pra we have a piperazine ring too, so here we have a piperazine ring too. Okay, so this here is the structure of prazosin, and prazosin contain furan ring in its side chain. Here in its side chain it contain a furan ring. Remember this, prazosin. So its uses are in hypertension, then in benign prostatic hyperplasia. Now what is this benign prostatic hyperplasia? What is this? Now this is the condition usually seen in men. Now as if this is your bladder, okay, and here we have prostate glands. Now this is the normal conditions. Okay, now here we have prostate glands, and in this bladder urine is stored. Okay, so urine is passed from here. Okay, so this is the normal condition. Now at the hyperplasia, the benign prostatic hyperplasia, this prostatic glands get swelled up, or they are hyperplasia, means the size of them increases. Now due to their increase in size, this urine here is not able to pass. It gets stored in the bladder only, or if it pass very slowly due to this prostatic glands swelling or hyperplasia in this prostatic glands. So this is the condition which is known as the benign prostatic hyperplasia. Okay, so it is used. This prazosin or the alpha-1 blockers are very important or used at this particular condition. Okay. Now moving forward, Raynaud's disease. Okay, I already told you about the Raynaud's disease. It is the vasoconstriction in our fingertips and the toes. So it is used there. Then talking about the side effects, again the orthostatic hypotension it causes, then the reflex tachycardia, the mild reflex tachycardia and headache. Now this is not blocking the alpha-2 receptor. Then also it is giving the side effect of reflex tachycardia. But here the reflex tachycardia action will be milder as compared to the non-selective one. Now why they are causing reflex tachycardia? As due to the baroreceptor reflex, they are still causing the reflex tachycardia, but their action or their effect will be milder as compared to the non-selective ones. Okay. Now moving forward towards the next drug, that is the terazosin. So from the name T, we have T, so it will contain a tetrahydrofuran ring. Prazosin was having furan ring. Okay, just furan ring. Now tetrazosin has a tetrahydrofuran ring, that is also known as oxolane. So here in its structure, instead of furan we have tetrahydrofuran ring. Rest of the structure is same. It also contain a quinazoline ring, as it is a quinazoline derivative. It contain a piperazine ring just like prazosin, but the difference is that it contain a tetrahydrofuran in its side chain. Now uses, it is also used in benign prostatic hyperplasia, then in hypertension. Now the side effects, orthostatic hypotension same, then the reflex tachycardia, okay, that is also same. Now the next drug we have the doxazosin. Okay, the now this doxazosin, from doxa we can say it has a dioxane ring. Now the prazosin contain the furan ring, terazosin contain the tetrahydrofuran ring. Now the doxazosin contain the dioxane ring here in its side chain. Now the rest of the structure is same for all three, just the difference is in a side chain. Now doxazosin contain a dioxane ring. Now talking about the uses, it is used in hypertension, then again the benign prostatic hyperplasia, it is used there, then the Raynaud's disease, this also used, then the side effect, orthostatic hypotension, reflex tachycardia, dizziness, same as the others. Now let's move forward to the next drug, that is 𝘂𝙎𝙎𝑖𝑛. Okay, 𝘂𝙎𝙎𝑖𝑛. Now from A we can say it has a aromatic ring in its structure, the 𝘂𝙎𝙎𝑖𝑛. Okay, so aromatic ring, we have two aromatic rings here. Then Fu, L-Fu. From Fu we can say furan. So furan is only present in prazosin. Here from Fu we are saying furan, but we have a tetrahydrofuran here. Now this is the ring. Sorry, I have told you here. So this is the ring, this is the aromatic ring. Okay, now we have a furan ring, the tetrahydrofuran ring here. Then from zo we can say a zipper chain. Zipper chain means a long chain. We have a long chain in its structure. So here we have a 3-membered chain, the propyl chain in its structure. Remember this, we have a propyl chain is 𝘂𝙎𝙎𝑖𝑛. Okay. So uses, it is also used in benign prostatic hyperplasia, then the hypertension. Okay, now the use in hypertension is very rare. Then the side effects is called, it causes dizziness, fatigue, headache and nasal congestion. Okay, so these are the side effects of this 𝘂𝙎𝙎𝑖𝑛. Okay, now the next drug, tamsulosin. Now from tamsulosin, from sul we can say it has a sulfonamide group in its structure. So here we have a sulfonamide group attached in its structure. Okay, Now this tamsulosin is uroselective. So in the benign prostatic hyperplasia, all the alpha blockers are used. Now the alpha blockers are first choice for this particular disease. But in those alpha blockers also, the tamsulosin is the first choice we give. Okay, and very useful in that particular disease. All other alpha blockers are also used, but first thing that we think is of tamsulosin. It is uroselective. Now uses is the benign prostatic hyperplasia. I already told you that. Then the side effects: fatigue, nasal congestion, headache and weakness. Okay. Now moving forward, next class of drug, that is the selective alpha 2 blockers. So before starting alpha 2 blocker, let me tell you one thing about the alpha 2 blockers, that these are not used clinically. Okay, clinically they have no use. We just use, the scientists use them for researches. Okay, that's it. Clinically till now they are not used. The first, now the drug here is 𝘎𝙬𝙏. So it is a natural drug and it is traditionally used in erectile dysfunction. Okay, it has a traditional use, that it is used in erectile dysfunction, not used widely clinically due to their stimulant effect. They have a high risk of BP and the limited safe application. Due to that they are not used clinically. Now talking about its structure, now it has imidazole ring in its structure. Okay, then we have a carboxylate group also. Now it says that it has a 𝘎𝙬𝙏 band. Okay, now this ring, this whole ring, these 5 rings together are known as 𝘎𝙬𝙏 band. So it has a 𝘎𝙬𝙏 band ring along with the carboxylate group here. Okay, so this is 𝘎𝙬𝙏. Uses, already told that it has a traditional use of the erectile dysfunction. Then the side effects: increased heart rate, high BP, anxiety. Okay, now the worsening of the Raynaud's disease, it can also cause worsening of this Raynaud's disease. Okay, clear? Are you clear? Everyone understood till here? If you have understood, then we will start with the MCQs. Come on, thumbs up. Give me a thumbs up if you are clear with the topic. Then we will start with some MCQs that can help you in GPAT. Okay, now you will get some idea that what type of questions are asked from this particular topic. Should I start with MCQs? So let's start with our first MCQ, that is inhibit the function of the adrenergic receptor. Now inhibiting the action of the adrenergic receptor is called. Now let's start with a simple MCQ. Okay, now this is the simplest MCQ that can be asked. Now it will not be asked in GPAT, but just to start with a simple, so I have included that. So what inhibits the function of the adrenergic receptor? What is it called? The adrenergic agonist, the adrenergic antagonist, both A and B, or propranolol? Come on, answer, I am waiting. Yes, yes, Kurman. Yes, Anjali, you are also right. It is the B option, that is adrenergic antagonist. Okay, now let's start with the second MCQ. Find out the given structure. Now what is the structure? Which drug? The tolazolin, phentolamine, carvedilol, prazosin. Which drug structure is this? I am waiting for your responses. Okay, You should answer. If your answer will be wrong, then it will be okay. I'll not say you anything. You will just learn from your mistakes. So answer, reply. Okay. So find out the given structure. Now, which drug structure is this? The tolazolin, phentolamine, carvedilol, or the prazosin? Yes. Yes, the tolazolin. Okay. Now, why tolazolin? As we already studied that in the structure of tolazolin. Tola means the toluene ring will be there in its structure, and zolin, that it will also contain a imidazole ring. Okay, so here is the toluene ring, here is the toluene ring, sorry. Here is the toluene ring with the benzene ring with CH3, and here we have a imidazole ring, so tolazolin. Now next question, which one is the beta adrenergic blocker? Now the propranolol, temulosin, prazosin, and phentolamine. So I have also included the MCQs from the beta blockers here that we studied in last lecture. So they are simple MCQs. You can just answer which one is the best adrenergic blocker. The propranolol, temulosin, prazosin, phentolamine. Come on, answer. Yes, the propranolol is the beta adrenergic blocker. Now it is the property, or we can say in every beta blocker, almost every beta blocker, there is a prefix that is the lol. So every beta blocker contains lol. So propranolol is the beta adrenergic blocker. Very simple question. Then next question, indole ring is present in. So which drug contain indole ring in its structure? I am waiting. Come on, you can answer. Participate. They are very simple questions. You can answer them. The indole ring is present in which drug? The yohimbine, levobunolol, both A and B, or sotalol? Which drug contain indole ring in its structure? I just told you about the indole ring. Which drug contain indole ring in its structure? Come on, participate. Students, participate. No, the answer is not D. Think about it. Not D. No, you are wrong. Think about it again. Which ring contain imidazole indole ring? Yes, Anjali, it is. You are right. It contains, yohimbine contains the indole ring in its structure. Here, yohimbine, it contains indole ring in its structure. I have told you about that. Okay. So yohimbine is the answer. Then the next question, identify the given structure. Now what structure? The drug structure is this: terazosin, prazosin, elfuzosin, doxazosin. Okay. So the doxazosin, elfuzosin, prazosin, or terazosin, which drug structure is this? Nimit, the B question, the B answer that you are given, are you giving for the fifth question? If you are giving it for the fifth question, that you are wrong. It is not B. No, it is not B. Clearly you see the ring. It is not B. Think about it again. The prazosin contains the furan ring. This is not a furan ring. Look properly. It is not a furan ring. Yes, the answer is A. It is a terazosin ring. Terazosin contains the tetrahydrofuran. So it is the tetrahydrofuran ring. It is not aromatic. Look, it is a tetrahydrofuran. So terazosin. The answer is terazosin. Okay, remember it. Then the sixth question, elfuzosin contains. Now the drug elfuzosin, What ring does it contain? So the structure of 𝘂𝑃 is almost same as terazosin. No, the 𝘂𝑃 has a different structure. Now what ring does it have? Which ring does 𝘂𝑃 have? Come on, answer. Come on guys, participate. 𝘂𝑃 contain which ring? Yes, you are right. It contains the tetrahydrofuran ring. Okay. Now moving forward to the next question, the ring present in prazosin. Prazosin. Which ring does it contain? What ring does a prazosin contain? Read carefully. For prazosin, read carefully. I am waiting. Participate. Come on. The prazosin, which ring it contain in its structure? From pra. What I told you, from pra. No, the answer is not A. No. Look properly. Read properly. What are the options? Furan, piperazine, quinazolin, all of the above. What is the answer? The seventh, the prazosin. Yes, the answer is D. The prazosin contains all the rings, the furan, the piperazine and the quinazolin. Okay. Now the next question, now we have ring present in timolol. Now this question is from the beta blockers. Okay, we studied it in the last class. Okay, the ring in timolol. Come on, answer, participate. In last class we did this, the timolol. Remember the trick that I told you, the timo. What ring does it contain? Timolol. Come on, participate guys. Yes, Anjali, you are right. Morpholin ring. Okay, so the timolol contain thiadiazole ring and the morpholin ring. So from Ti we learned that thiadiazole ring, and from Mo we know that we have a morpholin ring too in it, the structure of timolol. So morpholin. So here is the structure of timolol. It contains a morpholin ring and a thiadiazole ring. Okay, so timolol. Now the next question, following is selective alpha-2 blocker. Now what is the alpha-2 blocker? I told you. Alpha-2 blocker, guys. Selective alpha-2 blocker, selectively that block the alpha-2 blocker. Is it a prazosin, phentolamine, yohimbine or clonidine? Yes, Ankita, the answer is third, the yohimbine. You are correct. The yohimbine is the alpha-2 selective blocker. That is a naturally found drug that is used for erectile dysfunction. Okay. So, yohimbine. Now, let's move forward to the next question. Labetalol is a beta antagonist. Then, labetalol is dash, fill in the blank, the beta antagonist, then the alpha antagonist. So, now the labetalol, we studied that in beta blocker, it is a alpha antagonist. Okay, but is it The better alpha antagonist or the better beta antagonist? So, what is the answer? Yes, Kunni, Ramma, Anjali, Gopal, you were right. Now the next question, the 10th one you answer. Labetalol is dash beta antagonist than the alpha antagonist. Come on, answer. Fast. Yes, Nimit, you are right. The less potent. Okay. Now moving forward towards the 11th question, that is, how does the alcohol group interact with the binding site in propranolol? This question is also from the beta blockers. Now, how does the alcohol group interact? By the ionic interaction, by hydrogen bonding, by van der Waals interaction, or by no interaction at all? Come on guys, participate. It's a very simple question. How does a alcohol group interact with the binding site in propranolol? Ionic interaction, hydrogen bonding, van der Waals interaction, or no interaction at all? Come on, I'm not getting the replies now. Fast. Okay, so by hydrogen bonding, the alcohol group get interacted. So the answer is B. Okay, by ionic interaction we already studied the nitrogen group, the NH, the secondary nitrogen is best for that. So the answer is the hydrogen bonding. Now the next question, which of the following non-selective alpha blocker is used in pheochromocytoma? Okay, we studied the pheochromocytoma. What is that? The overproduction of the catecholamines like norepinephrine and epinephrine. So, what type of non-selective alpha blocker is used in that? The non-selective alpha blocker. Come on guys, answer. Somnath and Pawar. Somnath and Gopal Pawar, you were wrong about this question. It is not by van der Waals interaction but by the hydrogen bonding. Okay, remember it. The OH, the alcohol group, bound by the van der Waals, not by van der Waals but by the hydrogen bonding. Okay, now answer this, the pheochromocytoma one. Yes, the C is the right answer, the phenoxybenzamine. Okay, the phenoxybenzamine is the non-selective alpha blocker that is used in the pheochromocytoma. Okay, it binds irregularly. Okay, irreversibly it binds to the receptor. Okay, the phenoxybenzamine. Now the next question we have, which alpha 1 blocker is uroselective and preferred in BPH with fewer hypotensive side effects? Now what is BPH? Benign prostatic hyperplasia. I have already told you about that disease. So what is the alpha 1 blocker that is uroselective? Not okay. Alpha 1 blocker that is uroselective and preferred in BPH with a very few hypotensive side effects. Okay, what is that drug? The phenoxybenzamine, the prazosin, Tamsulosin or the phentolamine. Which drug? The alpha-1 blocker drug. Which is that? Come on, answer. Yes. Guys, come on. It's a very simple question. I already told you about that. I am waiting. Come on. No, Anjali, it's not B. Think about it again. I told you. The one uroselective drug. What was that? The alpha-1 blocker uroselective drug. Yes, the prazosin is also used. But even the phenoxybenzamine is also used. Phentolamine is also used. But and tamsulosin is also used, but which is the uroselective? Uroselective alpha-1 blocker plus it has a fewer hypotensive side effects. What is that drug? Nimith. Phentolamine is not alpha-1 blocker selective. Come on, answer guys. It's very simple. It's tamsulosin. Here we studied about this, na? The tamsulosin. It is uroselective. I already told you it is uroselective and it is the first choice. The alpha blockers are the first choice for this BPH, but in alpha blockers also we prefer tamsulosin the most. Okay? So the answer is C, the tamsulosin. Remember that. Okay? Got it? So if you have any questions, then let me see. You can ask. Otherwise, we will end the session. Okay, so hope you understood the lecture today. So let's end it now. Okay, if you have any question, you can ask me after the class also. I will definitely try to answer it. Thank you so much for joining.